This is Sara Prindle, and today I'm going to be performing a motor speech examination. Can you please state your name and age?
Trevor Prindle. I'm 26.
Do you have any family history of speech or swallowing disorders?
No.
Alright, I'm going to go ahead and get started then. So the first thing I'm going to look at is your facial symmetry, just to see if there's any abnormalities. And everything looks normal. I don't see anything that would cause issues with speech or swallowing. Now I'm going to look at your mandible structure, so your jaw. Nothing looks abnormal on that side. Looks good. Now I'm looking at your lip structure, so you're in a resting position and your lips are closed, which is completely normal. Go ahead and show me your range of motion, so move your lips all around for me. Perfect. And now we're going to look at your tongue structure range of motion, so go ahead and move your tongue all around, up and down, side to side. Perfect. Next thing we're going to look at is your dentition, which is your teeth. Go ahead and scoot close to the camera for me. Okay. Smile. All right, go ahead and open your mouth. Okay. Looking for any cracked teeth, anything out of the ordinary. I see you have a retainer on bottom. No retainer on top. Looks good. Next thing we're going to look at is your palate. Your hard and soft palate. Go ahead and scoot forward again and tilt your head back and say ah.
Ah.
Okay. Just checking if there's any cleft palate, which I don't see. And go ahead and say ah for me.
Ah.
Okay, one more time.
Ah.
Okay. I'm going to check your gag reflex. I'm going to poke in the back. Okay. Perfect. Moving on, we're going to look at your velopharyngeal function. So I'm going to hold this dental mirror up to your nose and see if there's nasal emission. So I'm going to have you say for me. Perfect. Just a little fog, and that's normal since is a nasal sound. Now I'm going to do the same thing, but you're going to say humbug, and I'm going to put the mirror under when you get to the 1, 2, 3.
Humbug.
Perfect. So looking at you when you talk, that you have saliva control. There's nothing out of the ordinary. You don't have excessive drooling or anything that would be cause of concern. Next, we're going to look at your respiration. So go ahead and just tell me about what you did today.
I woke up, I went to work, and then I came home.
Great, so everything sounded normal. You didn't run out of breath to speak, so your respiration looked great. Now I'm going to take a look at your ears, the external part of your ears. Just making sure everything looks healthy and there's nothing that would cause issues for hearing. Looks good. So next thing we're going to do is we're going to look at your cranial nerve function. So the first nerve that we're going to look at is the trigeminal nerve. So go ahead and open and close your mouth slowly. Perfect. Now I'm going to give you a little resistance. Do the same thing. Okay. Protrude and retract your jaw. Move your jaw laterally side to side. Click your teeth together. Next, I'm going to palpate your master muscle, so go ahead and just tense it up. Great, feel that. Okay, and the muscle under your chin. Good. So next I'm going to test for sensation on your face. So go ahead and close your eyes, and when you feel something on your face, you let me know.
Feel it. Feel it. Feel it. Feel it.
Next thing I'm going to have you do is say puff, 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 puff for 5 seconds, and I'm going to time you. Ready, set, go.
Puff, 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 puff,
Stop.
puff.
One more time. Ready, set, go.
Puff, 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 puff,
Stop.
puff.
Perfect. The next nerve we're going to look at is your facial nerve. So we already checked out your facial symmetry and everything looked normal, nothing that would cause for concern. Go ahead and wrinkle your forehead for me. Close your eyes tightly. Pucker your lips. Smile. Show your teeth and pull down hard in the corners of your mouth. Puff air in your cheeks. And go ahead and try and alternate side to side. Perfect. So now we're going to do the same puh, but I'm going to give you a bite block. So you're just going to keep this tight between your teeth while you say puh for 5 seconds. Ready, set, go. Stop. And one more time. Ready, set, go. Stop. Perfect. Thank you. So the next thing we're going to look at is your taste sensation. So I'm going to be putting some sticks with different tastes in your mouth. And you just let me know when you feel it and what it tastes like.
Okay.
Go ahead and open your mouth and say ah.
Ah.
Okay.
Yeah. It's sweet.
Okay. Next one. Okay, what's that taste like?
Sour.
Okay. Next.
It's salty.
Okay. And then the last one.
Yeah, it's bitter.
Great. So I'm going to take a look at your palate again. Scoot your face close and say ah.
Ah.
Okay. So now we're going to look and see if your palate raises when you say ah. Say ah again.
Ah.
Perfect. Looks normal. Now we're going to check the lifting reflex. I'm going to poke back there and it should lift up. Oh, okay, one more time. Tilt your head back a little. Make sure we get it on camera. Okay. There we go. Perfect. Good job. So we already looked at your nasal emission during your speech. I'm going to just look at your nasal emission while you blow out with your mouth. Nothing. Perfect. Now go ahead and puff out your cheeks and protrude your tongue. Perfect. Okay, the next thing we're going to look at is your vagus nerve. So I'm going to have you take a big deep breath in and hold your breath with your mouth open for as long as you can.
Okay.
Ready, set, go. Great. Relax for a second, and then I'm going to have you take another deep breath in and do it one more time. Great. So next I'm going to have you do the same thing, but you're going to say some sounds for as long as you can. So the first sound I'm going to have you sustain for as long as you can is ah.
Okay.
Ready, set, go. You're going to do the same thing for as long as you can with this sound. Now with the zzz sound. that one more time for each sound. So if you could start with ah again. Okay, and and last time with z. Great job. Next thing I'm going to have you do is match some pitches. So go ahead and give me a low pitch.
Oh.
Medium.
Oh.
High.
Oh.
Great. Cough for me. Now I'm going to have you make the ah sound and try to stop it with the back of your throat.
Ah.
Good job. The next cranial nerve we're going to look at is the spinal accessory. So I'm going to have you turn your head position and I'm going to give you some resistance.
Okay.
Head and turn towards me. Great. Okay. Now try to push your head forward and I'm going to give you some resistance. Good. Shrug your shoulders. Great. Next nerve we're moving on to is the hypoglossal nerve, which innervates the tongue. So I'm going to look at your tongue again. So go ahead and just have your tongue at rest.
Okay.
Protrude your tongue. Retract it. Lateralize your tongue side to side. Protrude and lift your tongue up towards your nose. And now the same thing down. Great. Now I'm going to push against your cheek and you just push your tongue against my hand. Okay. Good job. Okay, the next thing I'm going to have you do is some more sounds. I'm going to have you say for 5 seconds. So now instead of the puh, we're going to do ta-ta-ta for 5 seconds.
Okay.
Ready, set, go.
Ta 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 ta.
Okay, one more time. Ready, set, go.
Ta 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 ta
Stop.
ta.
Great. Now same thing, but with the k. So ka-ka-ka
Okay.
for 5 seconds. Ready, set, go.
Ka 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 ka
Stop.
ka.
And one more time for 5 seconds. Ready, set, go.
Ka 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 ka.
Stop. So now I'm gonna have you do the same sound, but with a bite block in your mouth again, like you did with the putt before.
Okay.
So make sure you hold on to that tight with your teeth. And now you're gonna do the ta sound for 5 seconds.
Okay.
Ready, set, go.
Ta 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 ta.
Stop. And one more time with ta. Ready, set, go.
Ta 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 ta.
Stop. Okay, now I'm gonna have you do it again with the ka. Ready, set, go.
Ka 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 ka.
Stop. And one more time. Ready, set, go.
Ka 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 ka.
Stop. Okay, I'm gonna take this out. So now we're gonna put all 3 of those sounds together. So it's gonna be pa-ta-ka. So you don't have to say it fast. Just make sure you say the right sound. So pa-ta-ka, pa-ta-ka. And I'm gonna time you for 5 seconds.
Okay.
Ready, set, go.
Pataka, 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 pataka.
Stop. And one more time. Ready, set, go.
Pataka, 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 pataka.
Stop. And last time, we're going to use the bite block again. Okay, for 5 seconds. Ready, set, oh. Got it?
Yeah.
Okay. Ready, set, go. Stop. And one more time. Ready, set, go. Stop. Great. All right. Okay, the next thing we're going to do is test your oral reflexes. So most of these are natural reflexes in babies, so there's nothing to be alarmed about if you don't have these reflexes, if they're absent. So we already tested the gag, so the first thing we're going to check is the jaw jerk. One more So your jaw didn't jerk open any when I did that. It stayed closed. So that was absent. Next thing we're going to check for is sucking. So if you were a baby, you'd be trying to suck on my finger while I ran my finger across your lips. Next thing we're going to check for is the rooting reflex. So babies would turn their head towards the sensation that they're feeling. It's absent in you. And next we're going to check the snout. Okay. So you didn't try to pucker during that, so that was another absent reflex, which is perfectly normal. And the last oral reflex we're going to check is the bite. So babies would probably, or would be trying to bite your finger or suck on it if they felt that sensation on their mouth. And then the last thing we're going to check is the oral control and sequencing. So go ahead and cough. Can you cough one more time facing the camera? Thank you. Click your tongue. Go ahead and blow on this tissue. Puff out your cheeks. Stick out your tongue. Lick your lips. Make your teeth chatter. Buzz like a bee.
Bzz.
Smack your lips and then cough. Bite your lip and then blow me a kiss. Great. Okay, so that concludes our motor speech examination on you today. From everything that I saw, you're within normal limits and there is no reason to be concerned about anything. Thank you.